The leader should be able to be held accountable by the employees that they're managing. The employees that are being managed should be able to be held accountable by the leader. But if the leader's not setting a good example as far as how to take criticism or how to be held accountable, then you're going to create a bad culture.
Hello, this is Zach with the American Journal of Healthcare Strategy, and you are listening to the Clinicians in Leadership podcast series, where we focus on empowering clinicians from bedside to boardroom. Today, I am joined in this episode with Dr. Joshua Todd. Dr. Todd, why don't you take a second to introduce yourself, tell us a little bit about your experience and your current role and how you got to where you are today.
As Zach said, my name is Josh Todd. I am a nurse anesthetist who also has an MBA. My healthcare journey started when my grandfather got sick with lung cancer, and he had some very good hospice nurses, which led me into the field of nursing as well. Once I finished nursing school, I went and worked in an ICU for 4 years, went back to anesthesia school, and then worked as an anesthetist for a couple of years. When COVID hit, decided that I was going to go back and get my MBA because I had noticed a lot of things plaguing the healthcare system, mostly from a operational inefficiency standpoint. And I wanted to find a way that I could make a difference on the business side of things. Currently, I am the VP of operations for DPI Anesthesia. We are a regional anesthesia group in the Southeast United States. We have facilities in Louisiana, Georgia, and South Carolina. My VP duties extend all the way up to South Carolina. I'm currently located in Baton Rouge, Louisiana. I'm also the chief nurse anesthetist at the Spine Hospital of Louisiana here in Baton Rouge. And I teach at Louisiana State University in their MBA program, Healthcare Operations Management course. And at Franciscan Missionaries of Our Lady University, I teach a healthcare leadership course and a healthcare policy course there, and chair 2 doctoral projects. So happy to be here.
Well, and we're thrilled, Dr. Todd, to have you today. And just in listening to you talk about your experience and over the course of our conversations prior to this interview, I was just struck by your combination of clinical experience and administrative experience as educational experience and as well as teaching experience. You're doing it all. That's quite impressive in a it's just impressive to balance it all. And I'm excited to dive more into your role of the VP of operations at DPI Anesthesia, and dive into a topic we've discussed back and forth in the number of our conversations, which is this topic of socially complex relationships. And we'll dive more into those later. But prior to doing that, I'm curious, with the wealth of experience in the variety of different fields within the medical field that you have, what have been some of the most, or one of the most impactful experiences that has developed your approach to leadership?
I think my approach to leadership really goes prior to my experience in healthcare. Prior to getting into healthcare, I played college baseball, and I think a lot of my leadership experience and exposure comes from good coaches and other guys that I played with that had qualities that I may not have had, and learning how they approach different situations and being aware of the way that they handled certain scenarios. I think once I got into healthcare, the poise that I brought from playing athletics and the ability to work with people from different backgrounds has really benefited me a lot. Where I grew up was extremely small town, Louisiana, like 100, 150 people. And then I go off and I'm playing college athletics with guys from California, Colorado, Canada, the East Coast, Florida, all over the place. So it was a bit of a culture shock to me. So I really had to learn to communicate in a different way. I had to learn to be open to different ideas and work with those people towards a common goal. And I think that's probably really been one of my biggest leadership growth opportunities is that prior to even getting into the field.
Well, and I think that should just be an encouragement to all the younger professionals that have an idea of where they want to take their careers, but maybe aren't quite there yet. Is that development, both personally and leadership and development of those characteristics, is happening now. And if you aren't taking advantage of that opportunity to develop where you're currently at, you're missing an opportunity. And just thinking, if you hadn't have taken some of those advantages and recognized just the benefit of being on a team and playing in those environments and seeing how that has benefited you now, that you're not where you are today without those experiences. And so I'm interested. You've mentioned a number of different times, and I think that your background, and specifically the story of how you got into the business operations side of healthcare, is exactly why we're having this conversation in the sense of clinicians and leadership, but recognizing that you were like, hey, there's got to be a better way to do some of these things. Where there's got to be some more efficient ways to do things, or operations wise. And I'm interested to hear a little bit about how your clinical experience affected your approach to your current role as the VP of operations.
Yeah. So my current role, what I really started noticing, even back when I was in the ICU, is there's a lot of redundancy in healthcare, especially in the United States. And when I went to Peru and did a mission trip, I realized exactly how much waste there actually is in our system. And I don't think all the waste is bad waste. A lot of the waste is infection prevention measures and single use items and things like that are not the same in other countries necessarily. But we take it for granted. And I think the biggest piece of getting into the business side was seeing those redundancies used over and over and over. And it feels sometimes like as a clinician that your job is becoming prohibitively difficult because there's so many steps in a process that could be narrowed down to where you can just care for the patient, because that's ultimately what the clinician wants to do. They want to be able to care for their patients. They want to be able to do it the right way, and they want to be paid fairly for their services. And that doesn't change whether you're a bedside nurse or whether you're a physician in the clinic, whether you're a surgeon, whether you're doing anesthesia like I am. It's all the same. We get into healthcare because we want to help people. And when our jobs become difficult because of the inadequacies of the system or the burdens of the system, then it leads to the situation that we talk about so much nowadays, which is burnout. You have so much provider burnout because of items that have absolutely nothing to do with patient care, and that's a big challenge for the system, and that's really what led me to want to understand the business side of things more, to try to make some kind of dent in that. I think we're probably going to get into some of the ways that we've done it in our company here just a little bit, but so I'll save that.
So, Dr. Todd, something that you and I have discussed, and something that your company is doing quite effectively right now is it's this notion of a socially complex relationship. And so for those that don't know, help walk us through just kind of a brief overview of what a socially complex relationship is. And then we'll dive a little bit more after knowing what it is. How can one develop one personally and also organizationally? And so what first, but just start us off with, what is a socially complex relationship?
So a socially complex relationship is a relationship where there are two entities, be it two businesses, two individuals, whatever it may be. And there's either a service or some sort of exchange of items. I mean, this could be a marriage, right? An exchange of vows. Socially complex relationship is a relationship where I'm doing something with you and I could choose to do it with someone else, but I don't believe that I could do that thing that we're doing better with anybody else. And usually there is, and especially in the business side, there's going to be a financial component to it. There's always a financial component in the business side. But ultimately what it comes down to is trust. There's going to be intrinsic value that has nothing to do with finances. That has to be created there, and that builds the relationship. It's kind of like, if your dad or mom or grandpa or grandma, you move into your first house and you have a sink break or something. They're like, hey, I've got a guy, and that's their plumber guy. That's their plumbing guy. That's everybody's plumbing guy, and that's a socially complex relationship. You could call whoever that you look up in the phone book back in the days when there were yellow pages, or you Google it nowadays. But you could call any service and they're going to be able to do the same thing that this guy is going to be able to do, but that person has developed a socially complex relationship with the people that to build that trust, and it may cost a little bit more for their services. It may take them a little bit longer, but the complexity of the relationship leads to continuing to do business with that person.
Well, and I think it's just helpful. Like the word you kept saying is trust, and building the trust between the two partners, or to use your example, between an individual and their plumber, and building the trust that, yeah, I could do with someone else. They could probably do it cheaper, but I know for sure that this other guy is going to get the job done and he's going to do it well. And you've hinted at a little bit. There's a additional value that a socially complex relationship brings to an organization, and so we'll get into that in a little bit. But I'm curious, how do you create and maintain a socially complex relationship, both personally, as an individual, but also how does a business create a socially complex relationship? How can you navigate those things and create those, knowing that those are beneficial for both parties?
I think consistency and delivering on what you say you're going to do are huge, especially in the business world. If you say we're going to do X, Y, and Z, you better do X, Y, and Z plus. You want to undersell and over deliver. And that's a common phrase used in business. A lot of people say it, but it's the truth. You have to provide some sort of something that is going to be tangible to the organization that you're working with, that is going to be beyond just what the set of deliverables are in the state of work or statement of work. So as you start to build the relationship, there's going to be opportunities that come along to where it may not necessarily be something that is in your piece of the puzzle, but it's something that you see that you can contribute to help, or you may have a piece of advice or a piece of information that you can contribute to the organization that's going to do absolutely nothing to benefit your organization from a financial standpoint, but it's going to make the overall functioning of the facility that you're at or the happenings that you're dealing with better. So you offer that up, and as you do those small things continuously or regularly, the organization begins to see you as somebody that they can trust, like I said, and they begin to see your opinion as valuable, and your insight as valuable, rather than it being, oh, well, this is just Josh saying something about whatever again. Then it becomes like the boy who cried wolf, right? You can't just point out every inefficiency. It has to be something that is going to be tangible and is going to make a difference. And ideally, you start with the things that are bigger, even if they're not necessarily something that, like I said, you have direct control over. And ultimately, if it's something that you don't have direct control over, you have to relinquish that control to the organization that is making the decision as to if they're going to change anything, because that's the big piece of this. The social complexity piece is there's certain things that you're going to deal with that don't have anything to do with your industry, and they don't have to do anything to do with your bottom line, but it provides a major amount of intrinsic value to the other organization. And that's something that's different than, say, I'm going to provide you with a service. This is your invoice. I'm going to provide you just with this, and then I'm going to leave. I'm going to give you this invoice. I'm going to do it. I'm going to pay you. Then I'm going to leave. You've given the deliverables, but you've brought nothing else of value. So it's great. Thank you for doing the work. It's wonderful. Everything's done. Everything's done with good quality. If I need you again, maybe I'll call you. but it's not going to make that person feel any different than it would have been had they called just any other random person to do the same service.
Well, and just the I think that mindset is just is helpful in general. One the constant evaluation of what we're doing and how can we improve is critical for the medical field as a whole. So that's an interesting component that you mentioned. But the other thing is taking in a sense taking ownership of what you do and expanding your just evaluation process and to see if there's things that you can be doing that'll better help the healthcare organizations that your business is partnering with. Because as a whole, even though that may be extra effort on you and not within your specific puzzle piece, to use your phrase, that ultimately benefits the healthcare organization, which ultimately benefits patients. And so there's a others focused or others centered mindset that is critical to building this socially complex relationship and maintaining it. And I think that seems so, odd. And when I just think about business today and especially in the
Yeah.
medical field, that's something that it's like, hey, this is my role. I don't, and that other stuff's not my problem because I'm doing my job. That seems to be the predominant mindset.
Yeah. You said a word that I use all the time: accountability. Uh, that's one of my favorite words, and it's accountability extends beyond just a leader holding their employees accountable, right? It goes up and down. It should. In a healthy organization, it should go up and down. The leader should be able to be held accountable by the employees that they're managing. The employees that are being managed should be able to be held accountable by the leader. But if the leader's not setting a good example as far as how to take criticism or how to be held accountable, then you're going to create a bad culture. That's a totally different conversation. But I just had to get on that soapbox for a second.
Yeah.
But yes, 100% accountability, and what I like to call it is a what can I do to help mindset. Rather than just being, I'm here to provide this and I'm going to do this and that's all I'm going to do. What can I do to help? And if there's anything that I can do to help, please let me know.
And like you said and identified correctly, that mindset, while you may have individual employees that have that mindset more than others, organizationally, that mindset starts with your leaders creating that mindset and putting that organization in a place where they are promoting that mindset, not just among their employees, but when they are interacting with other organizations. And so we've talked a bit about how your clinical experience has affected your operations experience. Talk to me a little bit about how clinical experience affects the development, or at least the approach to a socially complex relationship within the healthcare system.
So I'll go back to what I discussed earlier about kind of burnout and how our jobs can become more difficult than they need to be. And this is not a slight or a knock on people that are non-clinician administrators. This is just the reality of the situation from somebody who's been a clinician for 15 years. The understanding of what it's like to do patient care versus taking the metrics and the numbers, there's a disconnect there, right? And if you don't understand it from the clinician side, it's extremely difficult to get a grasp on that. As a VP of operations, I work with our COO very, very closely. He's an attorney by trade. So he has no clinical experience, and he does a great job of attempting to understand the clinical side. But I think as we've grown, moving to where we have a COO and a VP of operations and the VP being clinical, it's taken about 6 months to see a dramatic difference in the way he's able to function in his role and the providers are able to convey information through a chain of command. It's unbelievably different. And that's just a small thing in our organization. But I think the big thing, the overarching thing that's important to having clinicians in a leadership role in developing these kind of relationships is clinicians are going to bring things to the table that people that are purely administrators just aren't going to think about, because it's just not in their wheelhouse and it's not on their radar because they may not even know it exists. One thing that we did at the spine hospital where I'm at, that really had absolutely nothing to benefit our anesthesia company from a revenue standpoint, was we implemented erector spine A-plane blocks for posterior and anterior lumbar surgery. At the time, there was not a lot of literature on it, but our organization had had great success in using them in Charleston at one of our facilities, to the degree of success where the results were presented at the American College of Surgeons convention. So it was a pretty impressive showing by our folks up in Charleston. So we kind of got to talking at one of our leadership conferences that we have every year within the company. And I decided to take it back to one of the surgeons at the spine hospital and just see if it would benefit. It was kind of there's not a lot of good literature. Let's see if it helps. And it did. It helped tremendously. And we started tracking the data, and we were able to actually cut down on the narcotic utilization of the patients at the facility by 40% for their overall stay. Intraoperatively, we were able to cut down over 50% on our narcotic utilization. And in the world today, with the opiate crisis that has started to seemingly, hopefully, slow down, we kind of owe that to the patients, right? But in addition to that, the unintended consequence of that is we're now doing a nerve block, which generates anesthesia revenue. We are using a cheaper medication to provide longer acting pain relief to the patient that provides the same degree of efficacy if you look at the literature. And the patients, per the surgeon reports, in many scenarios could have probably been discharged a day earlier, but due to the nature of the hospital, they were having to keep the patients for the same time. So when you're getting paid out in these DRG payments to where the organization's getting a bundle, anytime you can save money on drug costs or time, the facility is going to see an increase in revenue, right? And then if we're generating more anesthesia revenue on our side, they're going to see a smaller subsidy. So again, we don't see a financial benefit from that. As the anesthesia group, the organization that we're working with sees a revenue increase because they're now saving on drug costs. We now have added anesthesia revenue. And if they start discharging patients earlier, they have more beds and can do more cases. That's social complexity right there, right? Especially when nobody else in the region is doing it. Now, is that something that any anesthesia group could do? Yes, it is. Every anesthesia group's trained to do regional anesthesia. They have to be. They have to be to graduate. They have to be to pass boards. They have to be able to do regional anesthesia. Is everybody doing it? Absolutely not. And the ones that are doing it, are they tracking it to make a difference? So that's kind of one initiative that we did. But back to what I was saying, that's not something that any of the administrators at the organization would have even thought of bringing to the table, where in the initial discussion and the initial idea was, how is this going to help the patient, right? Because I saw the success we had in Charleston with it, and I was like, man, that would be really nice if we could do that in my facility. Let's see what happens. Yeah. And then the consequence was, ideally, and potentially and likely, increased revenue streams for the organization that we're contracted through. So, and then they did the same thing in Charleston. So you see that in a different part of the company, in a different part of the country. So that's developing that relationship, and that's where a clinician is going to be able to bring something different to the table, because like I said, again, not a slight, not a knock on pure administrators, but what they're going to look at is how can we cut down on hours? How can we do more with less? Do we need more? Do we need less providers? Can we do this with less providers? Can we do this with less hours? Can we change the schedule up? Can we turn over faster? Can we bring people in later and help have them stay later? It's going to be more about adjusting the schedule than it is coming up with initiatives and creative ideas to solve the same problems.
Well, and I think it's fascinating looking at that example that you just provided. Just the benefits that healthcare organization sees, both in increased or decreased drug costs and usages, as well as just more time. You're finishing these surgeries quicker. As well as the impact that it could have on throughput, and that's wild to think about. Those combination of benefits is something that hospital administrators are constantly looking at areas to improve, and it's fascinating that I wouldn't think to look at the practices of an anesthesia group and to see if, hey, is there any way that we could help work in this area to help with those three things. Similarly, like you had said, the socially complex relationship, that's such a unique opportunity to extend beyond that puzzle piece, again, to use your phrase, and to really make a significant difference in the areas that matter most to those administrators, which is some of those things that we just identified. So I'm interested to again use your phrase of the puzzle piece, and to look outside your puzzle piece. How do you know where to look outside of your puzzle piece? How do you discern which opportunities to pursue that would be beneficial to that socially complex relationship?
I think a lot of that really requires situational awareness and understanding of everything that's going on around you. And that takes time. In a lot of scenarios, there's most people aren't programmed to think that way, to where you can look at the daily happenings around you and disconnect from whatever it is that you're doing. And this is a skill that doesn't come naturally, I should say, instead of a lot of people don't know how to do it or can't do it. It's a skill that doesn't come naturally, right? We're very me focused. And to begin to notice things that you could bring to the table, you have to look at your surroundings and almost step back to where you're looking at yourself as an observer and say, all right, where is the bottleneck? Where is the deficiency? Where is the frustration from the majority of the people around me? Is there a place that's causing a bigger issue for the whole? And what is that issue? And then before you bring it up, it's probably wise that you collect some data. Conversations always are easier to have when you have data. Data is unemotional. Data provides some objectivity to a subjective feeling sometimes. There's times where I could say, oh my gosh, I feel so overworked. And then you go look at the data and you look at the hours worked, and it's like, yeah, it was busier than last week, but it really wasn't that bad. Maybe it was just more strenuous from a metrics standpoint, right? So data is always beneficial. So identify something around you, collect some data, whether it be times that you need to collect, dollars. Usually time and dollars go together in healthcare. Understand how things are paid and see if you can make a connection between the things. Once you have a connection between the things, start brainstorming of ideas, what might fix it. And if you can't come up with anything, sometimes it's worthy of having a conversation of, hey, I've noticed these things. And this is the data that I've gathered. I think that this is something that we could probably work toward solving together. Do you have any ideas as to how I could help? And again, go back to that, what can I do to help mentality? And then hopefully something happens.
Yeah. So, Dr. Todd, we're about at the end of our interview, but I have one last question to ask you, and I think this will be an interesting one, more specifically focused on the leadership within an organization that's in a socially complex relationship. And so after you identify that opportunity to pursue, and recognizing that it's going to contribute to that socially complex relationship, but may not result in additional revenue, at least at first, for that organization, and may end up having causing a little bit of extra work for your staff and your colleagues. How do you promote buy-in? How do you get your organization, if you identified an opportunity to pursue a way that's going to develop and maintain a socially complex relationship, how do you promote buy-in amongst your staff and your colleagues?
I think getting buy-in at first is partially being hard-headed, because anything that's new, you're not going to get buy-in immediately, right? So it's easy to propose a new initiative, and unless it's going to give everybody a raise, you're probably not going to get buy-in immediately, right? Everybody might see that it could potentially be some value, but especially if it's going to create a slight amount of work for somebody else, it's going to take some time. And if you're not just a little bit hard-headed and you truly believe that it's going to be beneficial, it's easy to put that to the side. So trusting what you're doing and putting in the time to do the things that I mentioned before, gather the data, make the observations, and come up with a plan, and really just communicate with your staff. Make sure your staff understand what the goal is. Make sure they have clarity on what their role is in that. Make sure they understand why they're doing what they're doing. There's a book that I read about Navy SEALs that talks about communication being one of the primary problems of a team falling apart. And what's really mentioned in there very significantly is how much more likely people are to follow through with what they're being asked to do if they understand the purpose as to why they're doing what they're doing. And I think that has probably been one of the biggest things that I've taken into my leadership, is communicating with people in a manner to where they understand what the goals are and they understand what their purpose is and what they're doing. And I think that is probably one of the biggest pieces of getting buy-in. But again, it's not going to happen immediately in most scenarios.
Well, Dr. Todd, thank you for joining us today on the Clinicians Leadership Podcast, and it's encouraging to hear the ways that you and your organization have developed these socially complex relationships, and as well as just to hear the encouragement of, hey, development of these socially complex relationships within the healthcare industry can go a long way in addressing issues both from the organization standpoint, but also that the patients face every single day. And that, like you had identified several times throughout our conversation, that is the ultimate goal of every single person in the healthcare field, is to help patients and to be there for those patients. And so we thank you, Dr. Todd, for your time today, and for your insights and your experience, and for sharing with us. So and we wish you the best in all that you do. So thank you, sir.
Thank you, Zach. Thanks for having me.